Ozempic doesn't just make you lose weight. It rewires how your brain feels hunger, slows your digestion, and changes how your pancreas releases insulin. And for some people, it reshapes how your body manages food, fat, muscle, and cravings permanently. Most people think it's just a fat loss shot, but inside your body, it's more like a control switch, because dropping 20 pounds sounds exciting until you realize what else you're losing along the way. Ozempic is the brand name for a drug called Semaglutide. It belongs to a class of medications called GLP-1 receptor agonists. Your body actually makes GLP-1 naturally. It's a hormone released after you eat, and it acts like a traffic cop for your metabolism. It tells your brain you're full, signals your pancreas to release insulin, and slows your stomach so food digests more slowly. The problem? Natural GLP-1 disappears in just 2 minutes. Ozempic extends that signal to an entire week. 1 injection, 7 days of appetite suppression. So now what happens next is something that surprises most people. The hunger switch. That's why people say they just don't think about food anymore. Cravings shrink, snacking stops. Fullness lasts for hours. It's like someone turned down the volume on hunger. But here's the trade-off. When you eat less, you don't just lose fat. You risk losing muscle too. The muscle truth. What most people don't realize is this. Up to 1/3 of the weight lost on GLP-1 drugs can come from lean muscle. And losing muscle doesn't just mean losing strength. It slows down your metabolism and makes future weight regain more likely. That's why doctors now recommend combining these medications with protein intake and resistance training. Because Ozempic may help you lose weight, but it won't protect your strength unless you do. What it does inside your body. GLP-1 medications don't just target one organ, they influence your entire metabolic system. In the brain, they calm hunger signals from the brainstem. In the stomach, they delay gastric emptying so food stays longer. In the pancreas, they boost insulin while reducing glucagon. And in the liver, they stop sugar from being dumped into the bloodstream. The result? Lower blood sugar, smaller meals, and a much quieter relationship with food. But that same quiet often comes with side effects: nausea, fatigue, and digestive discomfort. The unexpected heart effect. Something surprising happened in clinical trials. Patients using GLP-1 drugs weren't just losing weight. They were also having fewer heart attacks and strokes. Scientists still aren't sure why. Maybe it's the blood sugar control. Maybe it's reduced inflammation. Maybe it's the weight loss itself. But one thing's clear. For people with existing heart disease, these medications might do more than control appetite. They might actually save lives. The side effects cost. Of course, every medication comes at a cost, and Ozempic is no exception. The most common side effects are digestive: nausea, vomiting, constipation, bloating, diarrhea, abdominal pain. These happen because the drug slows your stomach down, and that affects your entire gut rhythm. To manage this, patients usually start with a low dose and increase gradually. For some, symptoms fade over time, but not always. Rare, but more serious, risks include pancreatitis, gallstones, fatigue, and thyroid concerns observed in rodent studies. But perhaps the biggest risk isn't a side effect at all. It's what happens when you stop. Because for most people, once the injection ends, the hunger comes back, and so does the weight. The cost. Ozempic isn't cheap. Without insurance, it can cost over $1,000 per month. Some try to save money using compounding pharmacies, but those come with quality risks, especially online. Even with insurance, not all plans cover it, and very few cover it long-term. So before starting, ask yourself, is this a short-term reset or a lifelong subscription? Because if you stop the drug, you may lose the results. These drugs were never designed for someone trying to lose 5 or 10 pounds for a wedding. They're for people whose weight is putting their health at risk. People with diabetes, high blood pressure, joint pain, metabolic syndrome. If you've never seriously changed your diet, if you've never moved consistently, start there first. But if you've already tried everything and nothing seems to work, then yes, a GLP-1 drug might be the extra tool you need. Just remember, it's a tool, not a shortcut, not a miracle. How to use it wisely. If you choose to use Ozempic, here's what you need to do. Eat enough protein, at least 1 gram per pound of lean body mass. Strength train 2 to 3 times per week. Stay hydrated, include fiber, and get high-quality sleep because your hormones reset while you rest. The goal isn't to get smaller, the goal is to get stronger, healthier, and harder to break. The real question. Here's the real question. If the injections stopped tomorrow, could you keep the weight off? If the answer is no, then it's not the drug that needs to change. It's your foundation. Because when the medication fades, it's your habits that stay. Ozempic is powerful, but like any tool, it can heal or it can hurt depending on how you use it. If you're considering it, talk to a doctor, not an influencer, not a Facebook group. A real healthcare provider who knows your body and your risks. And if you're already on it, protect your muscle, fuel your body, and move with purpose, because losing weight is easy, but keeping your health, that's the real transformation. If this video helped you, hit that like button and share it with someone who's thinking about using Ozempic. Subscribe for more science-backed health content, where we don't sell miracles, we explain them.